The purpose of this lecture was for injury prevention. However, I am going to spend the next couple slides about the basics of injury treatment and injuries themselves. So let's think about the basics. That is RICE. RICE is a very common mnemonic used, where R stands for rest. What this means is that if you notice a gymnast has been injured in practice, please remove her from any activity, rest her. And by resting, it means at times they basically just sit down, they stay away from whatever activities causing any harm. In other areas, they need to be transported to a hospital. For casting or splinting, they need to see a doctor. So in the gym, you need to know when it's appropriate for them to just rest and have their mom and dad take them home, or rest to the point that they need to have a splint or cast to completely immobilize the area. So there's a broad spectrum here. But remember, your job is to protect the gymnast. When they are injured, remove them from all activity that may create further injury. Ice. Ice should be applied to the injured area for about 15 to 20 minutes initially to help prevent swelling of the injured area. However, do not apply ice in circumstances in which you're worried about a spinal injury, in which it's more important for them to be transported by ambulance to a hospital. If they have a dislocation, for example, of a joint, you don't want to mess with the joint by applying ice. You want to make sure, again, that appropriate medical personnel is contacted, arrive on the scene, and help to take care of the dislocation. So use ice commonly for strains and sprains, but not for severe injuries in which further medical care is needed. Do not compromise the athlete's health by trying to apply an ice bag, which may create further injury by moving the athlete. Compression of an area is very helpful to help to remove swelling. Again, just like ice, it's to be done in appropriate circumstances, primarily with strains and sprains. Strains of muscle, sprains of joints. And the compression can be used to hold the ice in place. If you fill up ice in a bag, a plastic bag like a Ziploc baggie, then you may use an ACE wrap or a compression elastic bandage to hold that ice in place. Sometimes we wet the bandage and you use the water as the watered down bandage as the first layer of compression. Apply the ice over that layer of compression and then finish wrapping with the elastic wrap to hold the ice in place. The wet bandage then helps to conduct the cold better through to the skin to help create compression with ice at the same time. Elevation of an injured area is also important. You try to elevate above the level of the heart. However, at times this may be difficult. For example, if a gymnast strains their high hamstring area, it'd be difficult for them to elevate this above the level of the heart. However, an ankle or a wrist, it'd be much easier for them to elevate it. So elevation of the injured area if it is appropriate. Remember that USA Gymnastics University offers an online course on first aid, and it is very beneficial for you to take this course. Having a first aid class is important for all coaches for proper care of the gymnasts in their club. Coaches, please understand that safety does not happen by accident. You need to have a plan to make your club environment a safe one. Each gymnastics club should have an emergency action plan for injuries. This plan needs to be reviewed with all coaches in the gym. You should have a plan for basic injuries, a plan for more advanced injuries, and a plan for catastrophic injuries like spinal cord injury. What occurs when an injured reoccurs to a gymnast? Please be prepared by having a good plan. Remember, it is important for all coaches to complete their safety certification and risk management training. That is vital. It is also recommended that each gymnastics club look for therapists and trainers and physicians that may be willing to visit their club and learn about our sport to have a better understanding of how to manage gymnasts with injuries. If they see a gymnast performing gymnastics, they may have a better understanding of what it is that the gymnast needs to do and may help with their care if they've sustained an injury. Please check out the USAG Athlete Wellness online PDF that we have that lists all of the health practitioners across the USA that have expressed a desire to work with gymnasts in their area. These practitioners have been screened and they have been approved by USAG and placed on a list which is available at usagym.org. Thank you very much. Coaches, you have the responsibility to your athletes and to yourself to continue your education. Please stay current. Attend state, regional, and national gymnastics congresses and courses. It is so important for you to understand that the sport of gymnastics in all disciplines changes over the years and that the knowledge base continually improves. Therefore, it is so important for you to stay current, to have an understanding of how to best effectively and safely train the athletes at your club. Thank you for your time, and I hope this presentation was helpful and thought-provoking. Best of luck to you.